like you said, they actually frequently ask. There are
Yeah,
things a lot of people are always wondering about. So yeah,
especially the breast spots.
yeah.
We're live. Love music and love life. We are Smooth 98.1. The show you are now listening to is Soul Sisters, and it's what you would listen to every Wednesday from 11 to 11:50 on the station that loves music and loves life. Again, we are Smooth 98.1. That is the dial, that's the frequency. If you're in Lagos or your radio device can pick up the signal. But if you're not, you can simply search for Smooth 981 FM on any radio streaming app and website, and you find us. You're searching for Smooth 981 FM Lagos. The Love Music, Love Life tag. Once you see the red and the blue, yes, that's us. And now we're currently streaming live to YouTube. It is youtube.com/smooth 981 FM Lagos. Again, youtube.com/smooth 981 FM Lagos. So that allows you to watch, to drop your comments using the live chat option, and also to share with somebody who is not in the same time zone, or maybe the person cannot listen on the radio. Better still, it allows you to save this so that you can go back to watch it later on. And I do have my guest already joining me virtually. Thank God for the beautiful wizardry of technology. Allows cross-country, cross-border, cross-continent conversations happen. She is an educator. She is an author. Her series are very interesting. Her books, if you follow her on Instagram. And most importantly, she's a telehealth expert. She's a wife, she's a mom. She educates you about a lot of things, is especially on reproductive health, sexual health, and so much more. And this is not a first, this is not a second, this is not even a third time on Soul Sisters. So please welcome with me Dr. Olufemi Idowu, popularly known as Check with Dr. O. Good morning.
Good morning, Sean. Thank you so much for having me again. It's always a pleasure to come on the show.
Thank you. Now, for the next 50, okay, it's no longer up to 50. Let's make that 47, 45 thereabouts. We'll be discussing something interesting. In fact, you can say some things. The topic today is frequently asked questions about women's health. So if you have any question whatsoever, we already have a compilation of some of those questions, but if you want to add yours to the list, by all means, you are welcome. Add it, send it. Send it as a WhatsApp message to 0809 444 0981. Again, 0809 444 0981. That is the WhatsApp line, while the call line is 01, no, make that 0201 448 9981. Again, 0201 448 9981. That's where you can, or that's a line that you can dial and ask your questions. So today, the aim is to educate you on some of the things about women's health, or educate you generally about women's health, and those questions that keep coming back and back and back, no matter the number of times you answer it, because somebody might not be listening at that time. So that's what we're going to be doing. And with pleasure, my name is Oluwaseun Olusegun. All right, without further ado, let's get right into it. And I think I want to start with the question of vagina. Yeah. So the whole vagina infection, vagina smell, what is the normal smell? What do I do when I seem to feel funny down there? So I'll just read it out like it is written. What is a normal smell for a vagina?
Mhm. Okay, so the vagina, one thing people need to know is that most women always expect it to smell like roses or perfume. They expect it to have some kind of, I don't know, I don't know what they are thinking in their heads, right? But the vagina is not supposed to smell like perfume or roses, right? It has its own unique smell, but at the same time, that smell is not awful. It's the smell that is just characteristic that when you smell it, you know it's the vagina. It's not awful. It's not strong. It's not something that should you it's not something that you actually smell. right? Unless maybe like you wipe down and take a tissue and really put it to your nose. So it's not something like once you enter a room, people can smell it, right? That's when it becomes a problem. So if it's not odorless, but it has its own characteristic smell that is at the same time not awful. The moment the smell of the vagina deviates from being unnoticeable, unless you like come really close or wipe down with it, shampoo it on your nose, and when you walk into a room, people can smell, right? Or it changes to something like maybe a fishy smell, right? Then that's the moment you should start getting worried. So you're never going to have a vagina that is smelling like roses, but at the same time, you should never have a vagina that smells awful, that is so strong that when you walk into a room, people can smell it, that is so strong that without coming really close, people can smell it. Usually, when people have um, strong smells coming from their vagina, smells that are so strong that you can smell it from a mile away, or that you don't have really have to come so close before you smell it, then it's usually a sign that there might be an infection or they have issues with their personal hygiene, right? So, for example, if you don't bathe regularly, right, even if you don't get the chance to bathe regularly, but you should at least rinse with water and wipe down, right? So maybe yeah, somewhere where you don't have access to a bathroom, but you should have access to at least water that you should use to rinse down. You don't even need soap. Water is fine, right? Rinse it down and wipe, right? So, and another thing is some people that sweat more tend to experience the smell more in terms of the smell is usually stronger for women that sweat more, especially if you sweat a lot down there, right? Because there are some people that really sweat a lot down there. So why this is because bacteria would usually mix with the normal bacteria of the vagina and give it an awful smell. So the bacteria from sweat will mix with normal bacteria from the vagina and give it an awful smell. So normally, just like every other part of your body where you sweat, if it's excessive and you don't shower regularly, it smells. That's the same thing as the vagina. So it's important that you have good personal hygiene. Shower regularly, that's clean the vagina regularly with water. And when you're bathing, mouth soap, right? And it's important that you change your underwear minimum of daily. If you're someone that sweats a lot down there, you might want to change it more frequently, like twice a day, right? So by midday, you're changing your underwear again, right? And if you're someone that sweats a lot and you're experiencing like that strong smell, you might want to bathe or clean the vagina at least twice a day, right? Because you know that you're a bit different from others. But generally, it's okay for your vagina to have a smell, but the smell is not just, it's not an awful one. It's just a smell that tells you, hey, I'm a vagina. That's it. Right? I hope that answered the question.
Yes, it does, but it leaves us with more questions. And one of it is, I can imagine somebody asking, what if I don't have the access to water? Can I use baby wipe?
Yes, you can use baby wipes, but you need to be careful about the types of baby wipe. Usually, when you want to use baby wipes, you want to go for the fragrance-free ones, right? Because those are the ones that are less likely to have chemicals that will irritate the vagina. Better still, you can just use like tissue and a bit of water, right? Just a little bit of water on it, right? But if you feel more comfortable using baby wipes, then go for the fragrance-free ones.
Okay. Well, like I mentioned, the explanation or the explanation brought up more questions, and two questions I would like to ask. Number one is your take and your thought on those sold feminine washes and the trend of vagina steaming and the likes. That's one. And number two, I'd like you to explain what yeast infection is down there. But for now, we'll take a breather. And when we come back, we'll get into the explanation. So if you're just joining us for the first time, today is about the women's health. So I'd say you should gather around, especially if you're a woman and if you're a man as well, so you understand better how to take care of your woman, your sister, your mummy, and you understand what goes on in their body and how you can be of help. This is Soul Sisters. It's the show for the sisters, by the sisters, with the sisters, but the brothers are very much welcome. It's Smooth 98.1.
Smooth 98.1. Absolutely no one does it better.
So we just have a quick ad break for 30 something seconds and we're back.
Okay. This topic is actually really interesting.
Yeah.
Because there are a lot of things that people talk about. One, then two, a lot of women, no matter how much you say, they don't listen. They will never agree.
I don't
Is
know
it?
why.
I don't know. They just believe that no, you just have to wash it and put your finger inside and be doing like this and washing it. But they're actually causing more harm. So you end up not listening and doing what you feel is it time to go back? Okay.
Love music, love life, love the sisters, love the brothers as well. But this show is Soul Sisters right here on Smooth 98.1. It's 12 minutes past 11 o'clock. My name is Oluwaseun Olusegun. I do have Dr. O with me. That is Dr. Olufemi Idowu. And we are talking about women's health, especially those frequently asked questions about women's health. We have started the conversation by talking about vaginal health. I think for the next 20 minutes thereabouts, that's all we'll discuss because it is a very much needed discussion and education. Now, my guest has started by talking about the smell, the natural smell of the vagina and what you should do to make sure that it stays that way. Now, let's move over to when it has a yeast infection. What do you describe as a yeast infection? How does it happen? How do you take care of it?
Okay. So vaginal yeast infection usually happens when the normal bacteria, right? The composition of the normal bacteria in the vagina that is supposed to protect the vagina is destroyed. And how can this get destroyed? One of the ways is by antibiotic abuse. Those people that any small thing, cold, catarrh, they just go and buy antibiotics from the pharmacy and take it without any prescription from a doctor. So if you're fond of abusing antibiotics, you're at risk of having vaginal yeast infections, right? Another reason is all these people that douche, use feminine wash and all the things that you mentioned, right? The vagina has a natural pH, that's a natural acid-base balance, right? So normally there's a balance of acid and base that helps to protect the vagina. When you use those products, some of them are more acidic or more basic. So they sort of tilt that balance, right? And it's that the change in that pH balance is actually harmful for the vagina. So the normal flora in the vagina, that's normal flora means normal bacteria in the vagina, is killed at that pH. Meanwhile, other types of bacteria now start to thrive in the vagina, right? And that's where you have infections. But in the case of vaginal yeast infection, it's not bacteria that is now thriving, but fungi, right? So yeast is fungi, right? So fungi starts to grow in the area, right? And then you start to have symptoms like severe itching down there. So you see some women really, really embarrassing type of itching, right? Then you start to have things like vaginal discharge, but it's usually what women usually see is like a whitish, right? Or is a cottage. We call it cottage cheese like discharge. If you've ever seen cottage cheese, it's a bit like creamy and it's like I don't know how to describe the texture. If you put it between your hands, it's a bit smooth. Like, just the way cottage cheese, like cheese, if you think cheese, the type that they used to show in Tom and Jerry, right? If you see how it looks like when you break it up, that's kind of like how the discharge looks sometimes, right? And sometimes you experience like redness in the area because of the itching and a bit of inflammation and all that. So, but the characteristic symptom that most women will see is itching. They will notice itching first, and they will notice that unusual discharge. Usually, this discharge, funny enough, doesn't even have any smell. It's just whitish or that cottage cheese appearance, and it's a lot. So you find out that your discharge is actually more than usual, right? Because normally we have what is called a normal vaginal discharge. Usually not excessive, usually doesn't have any awful smell. But in this case, there's no awful smell, but the consistency of the discharge changes. It's now like cottage cheese, it's now more whitish and it's much more, right? So if you notice any of such symptoms, then it's important to see a doctor immediately, right? So what they'll do is something called like a vaginal swab, right? So they can do a high vaginal swab, right? Take it to the lab and then watch it, and then they see that, oh, and this person actually has a yeast infection, right? And then your doctor will prescribe drugs for you. But it's important that you avoid the things that cause it so you can prevent having it. And one major one is antibiotic abuse. The second one is douching with feminine products or putting your fingers to wash the inside of your vagina, right? So let me clarify one thing, because when you say vagina, people just take the whole female organ and call it a vagina. No, we have different parts. There's the outer area that we call the vulva. So that's where like the clitoris is, labia majora, labia minora, and all that. And then there's the inner area that you cannot see with your eyes unless you put your finger inside. That is the one that is called the vagina. So the outer area needs to be washed every morning. You can use mouth soap and all that. Wash that area, right, with water. But that inner area, the vagina itself, it does not need any form of soap, any form of water, because it is self-cleansing. The moment you have to start putting your finger inside somewhere, then you're wrong. You're putting yourself in danger of all sorts of infection, right? So it's important to remember that the vulva is different from the vagina. Vulva needs to be cleaned daily. Vagina does not need any form of cleaning because it is self-cleansing.
Thank you. I guess that already answers the question about feminine washes and those scented liquids and whatever it is that people sell, especially on social media platforms.
Yeah.
But the one I don't get at all is steaming. Why would you steam? Why vagina steaming? Why? It's not
In
for
fact,
more.
the first time I heard about it, I was like, what? Like, wait, what? What does that even mean? I think I saw it on social media. Someone went to the spa and they called it V-steaming or whatever they called it. And you actually sit down like that and they'll put steam and they'll say they are putting some chemicals or something like that. So the belief is that that steam will help to kill off the bacteria, to remove all the infections and blah, blah, blah. But the point is, yeah, one, destroying the natural picture of the vagina, like I said. Then you're killing off the normal bacteria in your vagina that is meant to be protecting your vagina. Your vagina already has a special type of bacteria there that exists to protect it against unwanted type of bacteria. So you will kill both the unwanted one and the one for your vagina and leave space for more unwanted one and possibly fungi to grow there, right? So vaginal steaming is not necessary at all. It doesn't cleanse anything. You're not cleansing nothing when you steam your vagina. Rather, you're exposing yourself to the possibility of more infection. So if you went for vaginal steaming without an infection, chances are next couple of weeks after you're done, you're going to have an infection, right? And then you start wondering, well, I thought this steaming worked, but you start saying this scams you, right? So it's very important that we avoid practices such as steaming, using feminine wash, putting anything in there to clean it or cleanse it or whatever. It's not ideal at all.
Thank you very much. Now let's move over to another side, a table that a lot of Nigerians are sitting on. I don't know who created that table, but I would like us to mend or maybe shatter it. And it's the table of toilet infection or toilet disease. Is there anything medically known as toilet infection or toilet disease?
No, toilet infection or toilet disease is something that was created by somebody that had a wild imagination, right? You can't get infection from using a toilet, right? As in, you can't get genital tract infections from using a toilet. And that's because organisms that cause genital tract infections, such as bacteria, the viruses, right? They don't live on surfaces in the toilet seat for long enough to jump on the next person's body, like people imagine, and cause an infection, right? So they need to be in an ideal environment to be transferred from person to person. And that ideal environment is your body. That's why they are sexually transmitted infections. So they need to be living in someone else's body to be able to move over to yours, not living on the toilet to move over to yours. So people should get that clear, right? That you can, that they'll say, oh, I use the toilet and I stay here. No, it was not the toilet that caused it. It was probably because you were using your finger and washing the vagina when you were not supposed to, or you abused antibiotics or using feminine wash and all those things that you shouldn't be using. That's why you have not, because you use the public toilet. Sometimes it can also be in your head where you feel like, oh, this toilet is itchy. And then because you think it's cringy, you expect to start itching, and then your body tells you to itch, and you really start feeling like you're itching. It's not that you really got any infection or anything, right? And most times, if you think that you got an infection after using the toilet, it's usually not. It's probably because of something else you did, right? But anytime you notice any unusual symptoms or whatever, just check with your doctor. But most times when people come to us and tell us, I got a toilet infection, I got an infection from using the toilet, and I was like, yeah, you really did. Because people, no matter how much you tell them that, you didn't get that from this, they will tell you, they will testify. I know 10,000 people that got infection from using toilet. My grandma, before I was born, she got infection. People don't want to, when people are stuck in their beliefs, no matter how much you try to explain to them that it's not possible, science has proven this. So many experiments have been done, research has been done, and it has proven that it is not possible. No, they don't want to hear. They're stuck on their beliefs. So I hope someone out there will listen and be changed. Believe.
Dr. O has told you that there is no such thing as toilet disease. So please be free. Set yourself free. Receive your deliverance, as it is said, woman be loosed, or woman thou art loosed. So go with that freedom and make it permanent. But I'm curious still talking about toilets, and normally people do have the idea that it might not be as clean as theirs, the one that you have in your house. So how would you advise a lady uses a public toilet? Are there things that you say she should do if she wants to use a public toilet?
So if you want to use a public toilet, just for hygienic reasons, not because you catch toilet infection as a sexually transmitted infection or anything, but just for like hygiene reasons, you should be using I usually say avoid direct contact with the toilet seat, right? Use seat cover as, or wipe the toilet seat down with like disinfectant wipes if you can. Throw them in the bin, obviously not in the toilet because you block the toilet if you do that, right? If you can. Or better still, if you are in a toilet that you're not familiar with, say a public toilet, not maybe a friend's house or whatever, you might want to squat and use the toilet instead of sitting. But overall, if you use the toilet seat cover or you wipe down, you can sit down. There's no problem with that.
Thank you. If you're joining us for the first time, number one, you're listening to Soul Sisters on Smooth 98.1. Now, number two, we're talking about women's health, especially the frequently asked questions about women's health. Every and anything that we can discuss within the space of time that we have. We started the show at 11 o'clock, and currently it is 23 minutes past 11 o'clock. Now, if you have any question, you're welcome to send it to 0809-444-0981. Again, 0809-444-0981. Charles, I saw your message, but I can't read out that message. Thank you. All right, so we'll take a breather, and when we come back, we'll get started with talking about menstrual health, and considering the fact that we recently just had the World Menstrual Hygiene Day. So there's the question of, is there anything I can do about premenstrual syndrome? And what can I do to make my cramps easy? There's also the question of, do sugary things really make cramps worse? And things like that. So if you have any question related, you're welcome. But then Dr. O will be shedding the light on that. Keep listening to Smooth 98.1.
This one another 30-second break.
Yeah, like 1 minute though.
Okay, this one is longer.
It sounds like steaming will make it taste better. How am I supposed to read that again? Simply want to put me into trouble. Nigerians are a handful.
Big handful, though. Because sometimes when you discuss this topic, the way they come for you, you'll be like, maybe I should just keep quiet. Maybe I should not bother myself.
Oh my days.
Go ahead, make my day. I said it before and I'll say it again. May God have mercy on your soul. Come with me if you want to live. Life moves pretty fast. You really think you have a chance against us, Mr. Cowboy? You've just been erased. Feel focus on Smooth 98.1, Fridays from 11 a.m. Good luck.
Okay.
My name is Ego, and you're tuned into the smoothest dial of Lagos Radio for the best of everything music. Smooth 98.1.
She's very correct, and you're very welcome. This is Smooth 98.1, where we love music for the very best of R&B, soul, jazz, funk, Afrobeat, Afro jazz, Afro funk, high life, many songs like that. Call us your number one adult contemporary radio station. And we're not just about music, we are about talk as well, especially the educative, informing, and well, the entertaining talk as well. So right now, you are listening to Soul Sisters. It airs every Wednesday from 11 till 11:50. Today, we're talking about the women's health. And if you have any question, you're welcome. WhatsApp line is 0809 444 0981. My guest is Dr. Olufemi Idowu. And right now, we want to talk about menstrual health. First is the question of, is there anything I can do about premenstrual syndrome? So maybe you even start by telling or helping somebody to understand what premenstrual syndrome is about.
So the idea of PMS, that's premenstrual syndrome. So for some women, it's just like, what's that? For some other women, they do have those symptoms, right? So it's just like a lot of changes that happen in the female body. With your menstrual cycle come hormonal changes, right? So when those hormonal changes happen, then you start to experience certain symptoms. For some people, it's their mood that changes. They start to experience mood swings. That's when some people will say, "Oh, sorry, was my period," as in they are nasty to you, or they are moody, or they are more irritable, and they say, "Oh, sorry, it's because my period is coming." Some people will experience like breast tenderness. Their breasts sometimes will feel a bit bigger, right? Some people will start to experience even a little bit of cramps before the period actually comes. They'll start to experience a bit of cramping down there and all that. So, but the PMS that most people talk about is the PMS with respect to the behavioral changes that come with it, or the behavioral reactions that come with your period being on the way, right? And for the most part, it's important to note that it's not every woman that will experience this. Yes, some women do experience it, but not everyone. And some women just use it as an excuse to be mean, right? Some are not really experiencing the whole mood swings and everything. They're just already anticipating, so they're like, I'm going to be mean now because my period is coming. I'll use that as an excuse. Oh, sorry, it was because of my period, right? The same way some people use pregnancy to do and undo different things, right? So yeah, PMS is real, but not everyone experiences it.
So what do you do if you experience it? I mean, you have the cramps, you've got the back pain. Sometimes you
Mm-hmm.
don't even know what's wrong with you. Sometimes you're either bloated or you're very hungry. How do you handle it?
So it really depends, right? If you're someone that you know that you experience this thing, and if your cycle is regular, you can already predict when you are going to be experiencing it. So, for example, if your period is coming next week, few days before that, you know that I'm going to be feeling this or that. So, if you're someone that normally deals with mood swings, if possible, you might want to be away from people at that time so you don't behave irrationally towards them, right? For bloating, there are things that you can take that will help. Take less foods that contain gas, right? Things like beans, things like fizzy drinks and all that. Avoid it during that period. But if the bloating is much, you can take antacids, right? Things that we call antacid over the counter. There's Pepto-Bismol syrup. And we have what's this? Okay, I don't want to mention any brand names, but just ask your pharmacy for antacids, right? And that will help to relieve the bloating. Sometimes people say that chewing mint also helps to relieve the bloating, right? So you can try that as well. Then for back pain, obviously, I usually tell people, no, I'm back pain and cramps. There's no need to endure unnecessary pain. There's no price for enduring the pain, right? It's not about, oh, I'm a strong woman, I'm a Hebrew woman. If you feel pain, take pain relievers, right? Take over-the-counter pain relievers. They're available in the pharmacy. You can also use hot water bottles sometimes to help to relieve the cramp. Some people said it works for them, but people with really severe cramping or severe back pain, mild things like hot water bottle might not really help with the pain. So in that case, it's better to just take pain reliever. Some people also say exercising helps. Exercising can actually help to make the pain less, right? So you can try that. The most important thing is find what works for you, right, and stick with it. But if all else fails, pain relievers will definitely work. There are different degrees of painkillers. So you just have to find the one that matches your level of pain.
All right. Now, before I go to the question about sugary things contributing to cramps, if it is true or not, I have some questions, but I can't take them. Dear soul brothers and any soul sister that want to ask a question, please remember that the topic of discussion is women's health. Please don't take me to where I don't want to go. Storm Raider, I can't read that question on air. It is not a watershed program or belts. This is 11:31. We can't talk about some things during daytime radio. Thank you. Let's stick to women's health. Thank you very much. And if you have any question that you think is compliant with daytime radio, 0809, emphasis on compliance, I beg of you, 0809 444 0981 is the WhatsApp line, 0809 444 0981, while the call line 0201 448 9981. Thank you very much for your understanding. Let's continue. So let's talk about sugary things and how they make things, cramps either worse or not.
So, a lot of women will actually tell you, be confident that when they take, or not everybody, a lot, a good number actually, that when they take sugary stuff, especially around their period, maybe a few days before, or even while they're having their period, it does make the cramps worse, right? And it's very funny because when you look online, not enough research has been done around this like you would expect, right? But some studies have actually shown that yes, indeed, sugar can make cramping worse. So those women are not crazy after all. What they're experiencing is actually true. And this is because sugar tends to promote inflammation, right? And it like promotes inflammation and inflammation in the uterus, right? So when that inflammation happens, normally symptoms that you can use to identify inflammation is pain, redness, swelling, right? Those kind of things. So definitely when there's inflammation, one major symptom that always comes with it is pain, right? So that's why, because sugar promotes inflammation in the uterus, then it only makes sense that you would feel more pain or more cramping at that time if you take more sugar. So if you're and a lot of women do experience it, but not everyone. So if you're someone that has noticed that anytime I take more sugary stuff, then I have more severe cramping or I feel more pain, then you might want to cut down on sugary stuff or avoid them totally just for while you're on your period.
Thank you very much for your explanation. Yes, Tom Raider, I just mentioned your name. I can't take your question, but I hope you understand. Now, moving on, still on the flow. This one says, why is my period flow always heavy?
Okay, so there are a variety of reasons why your period flow might be heavy, right? Again, it depends on the hormone. Some people, they have medical conditions, maybe fibroids. Fibroids is one of the most common one in African women that causes heavy bleeding, right? It could be adenomyosis, it could be endometriosis, right? Whatever it is, if you experience heavy bleeding, and what do we say heavy bleeding is? If you have to change more than 6 pads, if you have to use up to 8 pads a day, right? Then your bleeding is probably, yes, then your bleeding is probably heavy, right? If you have to change, maybe your pad only lasts for like an hour, 2 hours, and you have to change it that frequently, then your bleeding is heavy. There are people that actually have to change that frequently. So if you realize that you belong to this category, then you might want to see your doctor to find out why am I having this heavy period, right? They'll do a lot of tests, check your hormones, do some scans, like pelvic scans, check your uterus and all that. And then they'll come up with a diagnosis. And then from there, the right treatment can be administered, right? So it's important that you are familiar with the nature of your periods, right? So that if the pattern changes, right? Now, if you, for example, some people have really light periods. If you are someone that you only change pad for hygiene sake, maybe your period is so light that you only change it 3 times, your pad 3 times a day, and you're changing it for hygiene sake, not because it's even full or something, right? Then all of a sudden, it increases to maybe using 4 or 5 pads a day, right? That is a change in your period that you should study, but it's not yet cause for alarm, right? Because it's not yet heavy, but for you, that might be heavier, but it's not yet like heavy in the medical sense, right? So you should just watch it. Sometimes when there's changes in the hormonal balance, your period can change to lighter flow, heavier flow. But when it now gets to the point where you have to be changing your pad every 2 hours, or you have to be using up to 6 to 8 pads in a day, then you might really want to check with your doctor and find out, okay, what really is the problem.
Thank you. All right, so this one still relates to the cycle, but it says, how do I deal with the emotional highs and lows and the pain I experience during ovulation?
Okay. So again, during ovulation, it's hormonal changes that are happening again, right? And your body is just preparing you to receive the sperm that is coming. It's preparing you for pregnancy, right? It's hoping that you get pregnant and then things take off from there. So one thing that a lot of women actually feel. So okay, let's start with the pain. Not every woman feels pain during ovulation. But there are some women that they feel something called middle pain during ovulation. So they feel pain from the side of the ovary that the egg is being released from. So the ovary is the part of your body where eggs are stored. That's your reproductive cells. And you have two ovaries, one in the left and one in the right, right? Now, every menstrual cycle, an egg can come from either ovary or sometimes from both ovaries at the same time. That's when we have non-identical twins, right? If um eggs from the two different ovaries are released at the same time and they are both fertilized, then we have non-identical twins, right? So
Mhm.
that part of the ovary or that side, the ovary on the side that is releasing the egg, some women start to feel pain on that side, right? One of those women, when I'm ovulating, I feel that middle pain, and I know that I'm ovulating one, and I know the side that is coming from. And for me, it's usually the right. Sometimes the left, but most times it's the right, right? So I already know that I'm ovulating. So if I was trying for a baby, I already know that this is the time to intensify my efforts, right? So it's a really good pointer for women that are trying to conceive, because when you feel that middle pain, so the middle pain is a dull, it's a dull, or should I say it's a sharp pain, but it's a pain that you can, it depends on your pain threshold. Like for someone like me, my pain threshold is quite high, so I can ignore the pain, right? But I know it's there. For others, it might be like too unbearable to go about your daily activity. So if you feel that pain, like I said, there's no price for enduring pain. Just take pain reliever. It only lasts for 24 hours. So after that 24 hours, the pain is going to go, right? Your body is just telling you, hey, we're ovulating. In case you're trying to have a baby, this is a good time to try. And if you're not trying to have a baby, then abstain this period because if you don't abstain, you definitely collect. So that's basically what the pain is about. Then in terms of what was the other question? Was it about controlling your mood? Okay, yeah, mood during ovulation. So
Yes.
another thing that your body does, remember I said it's preparing you for pregnancy and hoping you get pregnant. During ovulation is when a lot of women tend to have an increased libido. That's when they will be looking for like men to sleep with, because at that time they're like on heat. You know how a dog, they will say a dog is on heat, and during ovulation you're on heat, so you're looking for someone to get you pregnant, or maybe you are not looking but your body is looking, because that's what ovulation is all about. You need sperm to fertilize you to get pregnant, right? So some women actually feel an increased urge to have sexual intercourse at that time. And if you are trying for a baby, of course, that's good for you. Your body is trying to do the right things to make sure you're in the mood to get the result that it wants you to get, right? So some women might experience an actual increased urge, and um, some other ones, it might even be the reverse, right? There are some women that they're not in the mood, they're having all those mood swings, the pain is unbearable. So it's just like a whole pooper for their day, basically. But whichever way, because you already know if it's a regular cycle that, oh, I'm going to be ovulating around this period, then you should think of coping mechanisms to manage the pain. So, like, I mean, to manage the situation. So, if it's pain relievers, you use that. If it's about mood swings, you manage that. If you know, oh, I'm going to have increased sexual appetite, my husband is not around or my partner is not around, then don't watch things that will trigger you to want to remember that yeah, ovulating and stuff like that. So basically just develop coping mechanisms to deal with whatever the situation is.
Wow. A woman's life is quite interesting. Complex, I
It
dare say,
is.
from the pain that leads up to. So imagine it's like you only have 1 week off. There is the week before your period, you have some pains. There is a week of
Mm,
your period, you have some pains. Then you
mm.
prepare for ovulation, you have some pains. What's going on? Anyways, Like Dr. told you, you should know how to manage yourself, especially if the pain is unbearable. But I have a couple of questions we'll get to right after this. If you're joining us for the first time, we're talking about a woman's health, her body, what goes on in there. And if you have any question, please send them to WhatsApp 0809-444-0981. If you're sending a message for the first time, kindly include your name and your location. We'll be right back. So you almost can't do anything to control the libido. You just go everywhere hoping.
No. Just take your mind off it. That's the best. Control your thoughts, right? That's the best you can do, right? It's not like there's any drug you can take or anything like that. The body is doing what it's supposed to do. The purpose of you releasing an egg is for you to get fertilized and for you to get pregnant. So the body will do everything to make sure you get pregnant. Not only will you start to feel like you want to have sexual intercourse more, but your cervical mucus will also change to make it conducive for the sperm to pass through easily. Unlike every other time in your cycle, at this time, okay, is it time to go back?
Yeah. It's been a great time learning and getting to understand better how the body of a woman works and specifically your own body. So I guess one thing you want to take out of this as a woman is to pay attention to your body and know what goes on in there, the changes, the intricacies of it, embrace it, but know what to do that will stop triggering it, especially in those times. Let's just leave that. Now, I do have questions. And again, you can join the conversation by sending a message to WhatsApp 0809-444-0981. So I have this one that says, "Good morning, dear presenter. My wife experiences menstrual pain so bad it comes with headaches that affect her sight. She gets teary sometimes and other times unable to even open her eyes. What can you advise us?"
Yeah, so sometimes when your menstrual pain is that severe, chances are there's a medical condition attached to that or a medical condition causing that. So it's important that your wife sees a doctor to find out the cause, right, of the menstrual pain. But in terms of managing the pain, like I always said, painkillers really help, and there are different degrees, right? There's painkiller paracetamol, and there's painkiller of higher grades, right? That I don't want to mention, so people don't just go over the counter and be ordering it for themselves, right? So depending on the severity of your pain that you tell your doctor, the doctor will know what level or what strength of painkiller to prescribe for you to help to manage your symptoms. But more importantly than managing that pain, right? The root cause needs to be found and taken care of, right? So it's very important. Another thing she can do, like I said, some women say hot water bottle helps, right? During that period, if she's someone that sugar actually makes it worse, she can also avoid sugary drinks at that time, right? Exercising helps some people, right, with the pain and all that, but really, ultimately, to just take pain relievers, right? Pain relievers really, they do the job, right? All those alternate methods or approaches are usually for people that don't feel that mild pain. But if you feel that much pain, right, that the way some people do, they can't avoid taking those pain relievers.
All right, then. Thank you.
Yeah. So the advice would be his wife should see a doctor. Don't take that pain for granted. She should see a doctor. So find the root cause and let her get proper treatment outside of managing the pain.
Thank you. Now, moving over to urinary tract infection. Somebody said, I once heard that if you hold in your pee for too long as a woman, it could result in UTI. Is this true?
Yes, this can be true. So holding your pee obviously is not the cause of UTI, but it could result in UTI in terms of normally a woman's urethra is very short. Urethra is the tube that urine passes through to get to the outside of the body. And ours is very short compared to men that have a much longer urethra. So women are more likely to they're more prone to urinary tract infections, right? Because bacteria just needs to be like around your vulva and it can easily go up into your bladder, right? Now, when bacteria gets into your bladder, you pee more frequently, chances are you're going to push this bacteria out. But then if you hold that pee in, you're keeping the bacteria in for much longer and giving it time to multiply. And when it starts to multiply beyond a certain number, then you start to experience symptoms of infection. So it's important that if you feel the urge to pee, empty your bladder as frequently as possible. It helps to push out any bacteria that you might have picked up, maybe through sexual intercourse, right? Or while wiping, because some people, when they use the toilet, that's why they come and say they have toilet infection. Instead of them to wipe from the front to the
So
back, they will wipe from the back to the front. And now, what people don't understand is there's bacteria, normal bacteria. You see, when you have normal bacteria in the vagina, you have normal bacteria in the anus, right? And normal bacteria in the anus is good for the anus. Normal bacteria in the vagina is good for the vagina. The moment you take bacteria from the anus into the vagina, then you are causing a problem. Then it will lead to an infection. So most people, because of this bad habit of not knowing the correct direction to wipe or not being cautious of that, they take bacteria from the anus into the vagina. And then they start to experience some infections and they think it's because I went to use public toilet. No, it's because you didn't clean the right way when using the toilet. So that's another way bacteria can get into the sorry, I talked about vagina and urethra, right? Because there are two things that are there for the woman. There are two openings. There's a vaginal opening and the urethral opening. So when you're wiping, it can either go into the vagina and start causing all those infections for the vagina, or it can go into the urethra and cause a UTI, right? So that's why sometimes when some people go for test they're having urinary tract infection symptoms and you test their urine, you see something called E. coli in the urine. E. coli is the normal bacteria in the anus. How did it get into your urethra? Because you didn't wipe properly, right? So it's important that women take note of that, right? So don't hold your pee for too long because the more you empty your bladder, the more it helps to push out the bacteria. If it multiplies beyond a certain number, then even peeing will not help to clear that bacteria. You will need to take drugs, right, to treat to clear the bacteria.
thank you. So here comes an interesting question. Why is one of my breasts bigger than the other?
So, I don't know why people think it's weird. And you know what? Some women have actually never noticed that. Yes, one of your breasts is bigger than the other. It might be a tiny little different that you don't notice, right? But it's there. Everybody, no matter how fine you say your breast, except you went for surgery to go and arrange this type, one of your breasts is definitely slightly bigger than the other. For some people, it's so slight that they don't notice. Some people, the difference is obvious that anybody can notice. And those are people that find it more embarrassing, right? But for most people that the difference is slight, you really have to look closely to see that, oh, actually, one is, in fact, it took me a while to actually notice, even for me, myself, that, oh, one is actually bigger than the other. Right? So it's just an anatomical difference. If you look at it, even when we are fit, if you know one of your feet is bigger than the other, there's always a bigger foot. It's either your left foot or your right foot. They are never the same size, right? So it's just an anatomical difference. It does not mean that there is something wrong with you. However, it's important to know your body and know the size of your own breast. Like that's if one is bigger than the other, you need to know to what degree is the difference. Now, if that degree changes overnight, where it's now much more bigger than the other, and it never used to be like that, then you need to get it checked because it could also be a sign that something is wrong, perhaps breast cancer, right? But if that's how you have always been all your life, then there's nothing wrong with you. You're totally fine.
Thank you. So I hope that you know everything is fine with you. You are not abnormal. You're totally okay, except for any other thing like she just mentioned. So here comes, I wish we could make it our last. I'm a lady in my 30s. What are some health screenings I need to be aware of and do?
Yeah, so by the time you're in your 30s, one major health screening that you should be doing is pap smear, the pap smear test to screen for cervical cancer, right? It's a very common screening test that is ignored, especially in Nigeria. From the age of 21, you should have started going for a regular pap smear test, and you have to have it every 3 years, right? If you had a normal pap smear test, then the next one is in 3 years' time. However, if your pap smear test was abnormal, then your doctor may request you come for a test earlier, like maybe a year after the last abnormal test or 6 months afterwards, depending on what they found during the testing, right? But normal screening is every 3 years from the age of 21 years to screen for cervical cancer because cervical cancer is more common than we know it, especially in Nigeria. And it's usually gotten from one of the ways that you can get it is through the HPV, so that's human papilloma virus, right? And it's HPV can be transmitted through sexual intercourse. So a lot of people, one of the things that they get during unprotected sexual intercourse is HPV, and they may not know because at the time they may not have any symptoms. So rather, this HPV will now start to cause changes in the cervix over time that would eventually lead to cancer. So these changes can be picked up during a pap smear, and immediately you can get treatment. So another way, apart from screening to prevent cervical cancer, is by taking the HPV vaccine. And every woman needs to make sure that she gets full dose of the HPV vaccine, right? So even girls, right from a young age of, I think it's about 13 years, it's recommended that girls also get the HPV vaccine to prevent getting HPV, which could in turn predispose you to the risk of having cervical cancer. So that's one screening that you need to be doing at 30. If you have a family history of breast cancer, you might also want to be doing regular breast ultrasound to look for any unusual changes in the breast. But usually, without any positive family history of breast cancer, then we say start screening for breast cancer from around the age of 40, right? Start doing a mammogram or 45, start doing a mammogram to screen for breast cancer. So those are the two major ones that require screening. Other ones that maybe with positive family history might require screening or regular monitoring is maybe you had someone in your family that has endometrial cancer or ovarian cancer, then you have to do specific screenings for that. But the most common screenings that is recommended for women is one, pap smear test for cervical cancer, and two, breast cancer screening.
Thank you. Although quickly, I want to confirm. So since you said the cervical cancer is gotten from human papillomavirus or
It's
transmitted,
one of the ways, not the only way. Yeah.
one of the ways. So if she says,
Mhm.
well, I am not sexually active in any form, does it still mean I need to go for the test?
You no. Even if you're not, so HPV, like I said, is only one of the ways that you can predispose yourself to the risk of cervical cancer. Right? You can still get cervical cancer even without being sexually active, right? It's just that people that are sexually active, they have multiple sexual partners and all that, they are at higher risk because of that transmission of HPV. But even if you're not sexually active, you could still get cervical cancer. So it's important that you screen so that it is detected on time and you can receive the necessary treatment.
Thank you. And guess what? We've come to the end of the show for today.
Wow,
Yeah,
just
time
like that.
flies. And we couldn't even take all the questions, but it was a good chat. Thank you so much,
Mhm.
Dr. Wu. Always a pleasure to have you.
Yeah.
I look
Thank
forward
you
to
so
another
much for having
session.
me. Yeah, definitely. Let me know anytime.
I'll definitely let you know. And to everyone who's been a part of the show with your interesting questions and the ones I couldn't take as well, thank you for participating. And the video will still be there for you on YouTube. That is youtube.com/smooth981FM Lagos. Share with your family and friends, share with the brothers and the sisters so that everybody has better understanding and you know what to do and how to help the woman. And yeah, generally, education is really good. Next week, we'll be back on Soul Sisters from 11 till 11:50 on Smooth 98.1. And you can catch up with Dr. Olufemi across all social media platforms at Check with Dr. O, I believe.
Yeah, that's correct. Check with Dr.
Okay. On the other side, it will be Casbah with the African music. That's what we do from 12 till 4 p.m. right here on the station that loves music and loves life. My name is Oluwaseun Olusegun. Bye. Thank you.
Thank you for having me. It's always fun coming on the show.
I know. I always enjoy it. And today was quite
Yeah,
enlightening.
quite
I don't know how
interesting.
somebody will be
Yeah.
asking me if oral sex is dangerous or bad. Why would you ask me that at 11 o'clock? Ha,
And it could be children listening to radio.
right. And some, no, please. No, Storm Reader. Thank you. I almost screamed when I saw the message. I had to control myself. Like, yeah, thank you.
Yeah, by the way, I wanted to mention I know someone that you might be interested in